Hello, guys. Welcome to another informative session of the Health Info Africa show. As usual, we have a packed session for you. We're going to be talking about vaccines today. We're also going on to talk about the current rise of COVID-19 in Ghana. There are so many issues we need to discuss regarding this. We'll begin by talking about the burden on our healthcare system. We'll talk about how to prevent workplace infections. And we'll also talk about some of the developments regarding the COVID-19 situation, what's going on in our parliament. I mean, there's a whole lot for you to catch on this particular edition of the Health Info Africa show. So be with us for this whole duration, and then there's a lot for you to learn. At this point, I'd like to bring on my co-host Edward to share a few words before we take a break.
Hi, Kwame. Thank you very much for that introduction. And again, like we always do, Health Info Africa, we are here to give you all the information that you need, the current updated information. There's so many, I would say infodemics going on where people are just spreading false information, but we try to bring the most intelligent people, the most knowledgeable people, including the likes of Kofi and Kwame. We always do this, and we want you to share the feed so that people will benefit from it. And then you'll be able to ask all your questions through the comment section. Again, share our feed, and we'll be right back after this break.
All right, thank you, Edward. I'll take over from here, and at this point, I'd like to bring on Dr. Angela Mensah. So Dr. Angela Mensah is a clinical pharmacist specialist with Kaiser Permanente, and she has been instrumental in running their COVID-19 vaccination clinic in Washington, D.C. She has a lot to share with us. She's going to talk about the kinds of vaccines that are available and also try and talk about some of the conspiracy theories that are, currently associated with these vaccines. We'll move on to have her give us her experiences running the clinic over there in DC. And we'll see how some of these can be applied to our settings back home in Ghana. So it is true that we do not have vaccines yet. We do not know when we are going to start vaccines, but in our fight against COVID-19, we have been very, very reactive, and we should not take this approach towards the vaccination. So we need to make sure that we are well equipped and then ready to address the issue of vaccines. So, Angela, welcome to the Health Info Africa show. It's a pleasure to have you here. Do you have any words you want to share with our viewers before we begin your presentation?
Yes. Thank you so much, Kwame Afosa, for that introduction. My name is Angela Mensah. Like Afosa said, I'm a clinical pharmacy specialist here in the DC metro area. I currently practice in 3 different jurisdictions: the states of Maryland, Virginia, and also the District of Columbia. So I just wanted to bring my perspective on the mass vaccination rollout for COVID-19 and see what questions people have regarding receiving the vaccine and any safety concerns or efficacy concerns that can be addressed. So if anyone has any questions while the conversation is going on, feel free to chime in the comment section, and we'll do our best to go through all the questions as much as we can. And I think Afosa brought up a really good point. I know currently there are no vaccines being administered in Ghana. They are on their way. I know WHO has made some allotments to some African countries. So we're expecting those vaccines to start rolling into Ghana. So this conversation is very important in the sense that it will be better for the health system or the personnel or to have the logistics in place before the actual receipt of the vaccine so that the rollout will be seamless and less chaotic, and it will be more impactful for the people we are actually trying to vaccinate.
You thank you very much, Angela. Angela has a few slides she would want to go through, and we'll do this as and when they become available. At this point, I'd want us to take another break, and then we'll be right back.
It no be wanna photo. Say we dey fight.
It is the senior most community pharmacist, Dr. Tuli.
Tompo Asembeng.
Oh, no lie. Then I say if your driver can't pick you, I make you people give me lift go. Shackers inside now. I'm at say so on link copy. But
Tompo, 11 p.m.
oh, if it comes self a seed in the who give me. I guess some entanglement before that side.
You know they hear social distancing, eh?
Tuli pe fam D, sem crowd the whole. As I be young in the Emas are they cool. If you no go pick me to catch him in small left.
See, this be the problem. Who tell you say corona dey affect youngins? If you know they care about your life, if a guy say NSL be over 50 years, away ya get hypertension, way poppy to be diabetic. Charlie them their cold will mess them up.
You are go wear face shield.
And that changes anything? That thing they protect only your eyes.
Plus face mask.
Charlie, the youth will they take this thing for granted. It may not kill you, but if it give you long-term damage to vital organs like your lungs, if you go get for outside cargo house, they give your OGs where them die. Will you be able to fend for yourself?
Chama, so I can say because unless I start they do Yahoo, I enter Benino, na phone cost me this the COVID said make it left one at top. Who?
If people know they follow simple directions like social distancing, hand washing, wearing face mask and things, the COVID no go anywhere. And the way they make careless there, it be like you no go left with anytime soon.
So to lazy my shadow make beans in.
If you love yourself and the people around you, they house and take your shadow go back cry.
You are here, you more like dog knee. So they kill my vibe cry.
But we for take responsibility and keep fighting with positivity. Never
All right, welcome back. Now we're ready to go on with Angela's presentation. So, yeah, Angela, can you take this?
Yeah, so I just wanted to have this on record that I have no financial relationship with any of the companies that will be discussed today. And the views that will be expressed here are not those of Kaiser Permanente of Foundation of the Mid-Atlantic States Incorporated. So just so we have this on record.
Okay. All right. Thank you. So can you briefly tell us about the currently available COVID-19 vaccines and how they work? Are there, and when you're talking about this, can you address if there are any advantages of one over the others?
Sure. So if you can put up the next slide, that would be great. Okay, so currently, the different technologies being used in the development of COVID-19 vaccines, but the one that has got a lot of airtime is the messenger or mRNA vaccines, which is the Moderna vaccine and the Pfizer BioNTech vaccine, which currently have emergency use authorizations with them. So what these vaccines do is that when you administer it to a patient, they are basically telling, the vaccine is telling that patient or the recipient's body to make it gives it a blueprint which allows it to make part of the spike protein on the coronavirus. So once the body does this, it's able to mount an immune response like in any infectious process. So this technology is not new. It's been around for a fairly long time, over 20 years. It just so happened that we found use for it. So again, this has been studied over the years, and it's not something that just came out of the blue. So once that mRNA tells it does what it's supposed to do, it breaks down in the body. It doesn't integrate with the body's DNA in any way to cause mutations or anything of the sort. What most of the conspiracy theorists are latching onto. So again, once that job is done, the mRNA is broken down in the body. It doesn't linger around or does it integrate with the host's DNA. Can we go to the next
Yeah.
slide?
So Angie, just on this same issue you're talking about, I want you to re-emphasize what you just said about it not causing any genetic mutations, because we've talked about this previously on the show. We've highlighted how this isn't possible, and yet this happens to be the main conspiracy theory that is being spread. Can you again hit on that particular issue, because people seem to be very concerned about that?
Concerned about that. Okay, yes, yes. So, like I said, let me reiterate. The messenger RNA technology has been around for decades. It's been studied extensively, and it just so happened that we found good use for it in the development of a vaccine to treat or to prevent COVID-19. So, let me give you an example. Um, there are other vaccines that are developed with other technologies. So, for example, the influenza vaccine, generally it's an inactivated virus that's introduced into the body. But some people do have an anaphylactic reaction or a severe reaction to that kind of vaccine. So that times the CDC recommend that you give them a different kind of vaccine, which has no egg component or the specific component that patient is reacting to. And that vaccine is actually made from recombinant DNA, and it's the flu block, which is a flu vaccine that has been administered over the years for a long time, and there have been no issues with even that type of recombinant DNA vaccine. So same goes to show that the vaccines actually tell the body to do what it's supposed to do, and whatever messenger was sent breaks down. It's not going to linger around and integrate with the host DNA to cause mutations down the line or any genetic abnormalities down the line. So we just have to keep that in mind and do our own research, read more about this technology before so that we have some educated information on these vaccines.
Okay, so there you have it from somebody who is in a vaccine clinic, who knows about how these vaccines work, telling us that it is not going to cause any genetic mutations. So hopefully a lot of people will believe this now, but we'll keep on hammering this message from time to time, just to let people gain more confidence in the vaccines that have been rolled out for COVID-19. So yeah, Angela,
And
can you continue with your talk?
yes, and to the second part of your question, whether there's one vaccine is preferred over the other. Right now, there's nothing like that. Usually, the ACIP we call that committee ACIP. Would you usually give recommendations for one vaccine over the other? But given the nature of COVID-19 and the limited number of vaccines we have available, there's currently no recommendation to use one versus the other. I guess I do believe that the choice will depend on the availability in the state or country and how the hospital system decides to roll out or implement their vaccination program. I've had patients come to the clinic and ask me for specific vaccines. Oh, I want the Moderna one because my friend got the Moderna one and they did fine with it. They didn't have any side effects or reactions. So I want the Moderna one. So and at the clinic, mostly we administer the Pfizer vaccine. So I just take them through the vaccine allotment and the fact that there are no specific recommendations as to which vaccine should be administered over the other. If it's available, let's vaccinate as many people as we can. So that's what I tell them. There's really no advantage of one over the other.
Okay, all right. Thank you very much. Can you continue with talking about the other types of vaccines that are
Okay.
available?
So the vector vaccines is this technology is also an interesting technology. This is what the AstraZeneca and Johnson and Johnson vaccines developed from. So you have a weakened live virus like an adenovirus, which are usually non-infectious viruses. You integrate genetic material of the coronavirus into the adenovirus, and administer it in the form of a vaccine to the recipient. So once the vaccine is in the recipient's body, again, it tells them to mount an immune response and go through the whole infectious process. So the next time they are infected with COVID-19, the body knows exactly how to respond to it. The very last technology is a good old live attenuated, or the inactive vaccine technology. And like I said, these technologies have been around for decades. And influenza vaccine, pneumococcal vaccine, and a slew of other vaccines that can be administered were developed through this technology.
All right, thank you very much, Angela. Now, there's one more question, or there's one more thing that usually comes up when we are discussing vaccines, and we've heard this a lot: efficacy. So we heard the Pfizer BioNTech vaccine is has an efficacy of about 90%, about the same for the Moderna vaccine. And then with the AstraZeneca Oxford vaccine, we heard it was somewhere between 50, 90, so 70. Can you tell us what the efficacy means in real terms? When we say the efficacy of a vaccine, what are we really talking about? How does it translate to something meaningful for the ordinary man?
Yes, yes. I'm not really good at math, so I'll stay away from all those numbers. But efficacy just means how well the medication or the therapy worked in the lab. Usually, that gives us a good indication of how the medication or the therapy is going to work in the real world. But as clinicians, what we are really interested in is the real world data. So, how if the actual effectiveness of that specific therapy when you administer it to the general population. So, for all the COVID-19 vaccine trials, what they evaluated was efficacy. So, the results were based on the reduction of documented COVID-19 infections. So, the person must have had symptoms plus the confirmatory test for coronavirus, which of course is your PCR, which is a more sensitive and specific test for this coronavirus. Right now, what we don't know is whether the vaccine actually prevent asymptomatic infections. There are a lot of us are walking around with coronaviruses that we don't even know and just spreading it. So once this mass vaccination is rolled out, we'll be able to get more data to support whether the vaccine actually prevents asymptomatic spread or not.
All right, great. So that begs the next question. We are in the middle of vaccination, especially in the US and other countries. And one thing that we are seeing currently is emerging strains, different types of the coronavirus. The question that we want to find out is that would these vaccinations or the vaccines you're receiving, would they be effective against these vaccines? And if not, do we even have to get these vaccines at all?
So yeah, great question, Edward. I know that there's been a lot of chatter on the media regarding these emerging strains, but the information we've received from Pfizer and Moderna is that yes, their vaccines are effective against the new and emerging strains. And again, this is all new to all of us. So once we have this huge undertaking of mass vaccination rolled out on a larger scale, and we have more people vaccinated, and we get more information on whether the vaccine is actually preventing someone from getting COVID-19 or transmitting it, we'll be able to have more robust data to support the effectiveness of these vaccines against the new variants.
All right, great. So the next question that we wanted to, since you're a frontline worker, you've been vaccinating people, is that, is it okay to hold off on the second dose? We've heard a lot about, the first dose is okay, the second dose, you get a little kick here and there. How soon should you get it, or how late can you get a second dose if you happen to be lucky to be having a vaccine?
Okay, great question. So these two-dose vaccine series, what I'd say is it's absolutely important for the recipient to get those two doses. Take the Moderna or Pfizer vaccine, for instance. The first dose is usually what we call a primer. So it's actually laying the groundwork for your body to mount that immune response. So once you get that dose, your body is about it's hovering around about 54% effective in preventing COVID-19. So when you throw that second dose in, that's when you have your 91, 92, 94% effectiveness. So it's important to come in for that second dose. And at our clinic, what we do is once you come in for your first dose, we automatically schedule you for your second dose. So we don't even give you the chance to say that, oh, hey, I couldn't get an appointment for the second dose, because we know it is important to follow it up with that second dose, which is the booster dose, to mount the full immune response that the body requires. And like for these particular vaccines, the Pfizer BioNTech and the Moderna vaccines, let me talk about the Pfizer BioNTech first. So the timing of the two vaccines is day 0 and 21 days later. So the data is showing that if the second dose is administered anywhere between 17 and 21 days, it's good. So if you can receive the second dose anytime between the 17 and 21 days, you're good. But that's all things being equal. But we know people can't get to places, things come up, emergencies pop up, and stuff like that. So if someone cannot come in on that 21 day or within that window, the recommendation is to go ahead and administer that vaccine as soon as possible. There are other vaccine series, like some of the childhood vaccinations, where the same rationale applies. So once you miss the timing for the second or third dose for about a few days, we don't restart the whole series. We just go ahead and give it to you as soon as possible. So again, I stress this to my patients on the daily, that once you get this vaccine, the first dose, it doesn't mean you're totally immune. You have
Right.
to plan for that second dose.
Right, great, great. So the last question before we end this session is about, some of the problems and challenges that you're having, even in the United States. The rollout of vaccines has become problematic. Can you share with us what are some of the hurdles you have to go through, and what is really holding up the rollout of vaccines? And also, just in case, Ghanaians have it. What problems do you foresee us going through, even if the United States is struggling? I can imagine what will happen down there. But what are the problems we can start talking about so that we will be aware of it?
Okay. Okay. So, from my experience, the biggest hurdle for people just to accept the vaccine in general is that vaccine hesitancy, what we call vaccine hesitancy. Because most of us feel that, oh, this was rushed, because most vaccine development takes time, with in-depth trials, with extensive data and stuff like that. So getting a vaccine for COVID-19 within a year, most people think that's too soon. But given the circumstances right now and how deadly COVID-19 is, I think all hands were on deck. We just needed to find a way to kind of prevent the spread of this deadly disease. For example, here in the US, there are some medications that can be used, or they are designated as compassionate use. So if someone had cancer and very terminally ill, and there's a medication being studied for that particular cancer and it hasn't even been approved, what the FDA does is that it can authorize physicians or clinicians to start prescribing the medication to help someone who is terminally ill, even though the medication hasn't been fully approved. It's a similar rationale. Like I said, given the nature, the complexity, and the deadliness of COVID-19, I think the emergency use authorization kind of use the same rationale, to have the vaccines out there, administered to people. Let's see how it works in the general population. Then once we have more data on it, we will be able to streamline things going forward.
All right, so we do have a question on Facebook asking us about do we know if there's an existing test, being a rapid or PCR, that detects the emerging strain, or further tests are required to tell you the type of COVID one has?
Right. So I did read some of these medical journals which said that there are a lot of different PCR tests on the market, but some of the specific PCR tests were able to detect the new variant of the coronavirus. So I don't believe it's all the tests available on the market. It's specific tests that are able to detect the virus.
All right, so thank you very much for that information. And again, we have very intelligent and brilliant ladies today who are going to bless us with a lot of information. So don't touch that. This is one section. We have more to come. If you have any questions about vaccines and how it affects you, the side effects and everything, Angela is still going to be around. She will answer your question. Keep that coming through the Facebook feed, and keep sharing the feed as well. So without much ado, I'll bring on my co-host Daniel to take the next step in the next section.
Yeah. Thank you very much, Edward. And that was a really fantastic first section. So now we're going to talk about COVID-19 and the current surge that we're experiencing in Ghana. To do this, I want to introduce the other guests who are all currently backstage. I'm going to bring them in one after the other. We have a really important lineup today. We're going to cover a lot of issues. We're going to start by talking about the new developments in the week in Ghana. There's so much going on. We're going to talk about how we can prevent workplace infections. We can also, we are going to talk again about the burden that COVID-19 is placing on our healthcare system. We'll spend a little time talking about what the ECOWAS and then the AU are doing, what our regional response is. And so at this point, I want to bring in the other panelists. I'll begin by bringing in Ifwa Owusu, and then I have Nana Kofi Kwachi is also here with us. There are others who will come in with time, but whilst we wait for the others to join in, I'd want Ifwa to tell us a bit about herself, and then Nana Kofi is a regular panelist, but he'll share a few words. Hi, Ifwa. You can go on.
Hello. So my name is Dr. Ifwa Owusu. I'm a medical doctor. Right now, I've branched off into more public health. I work with an organization called AMISE. That's our main areas of specialization are health services management, quality improvement, and health law. I practiced as an anesthetist for 3 years, so I've got a diploma in anesthesia. But right now, I've taken a break from that, and I'm doing more public health. So
yeah, public health work is very important, and with COVID, I'm sure you are facing a lot of challenges. I mean, communication and all that. It's quite hectic, I'm sure.
It is. I mean, but in this case, I dare say I would be more needed on the anesthesia side of things if I was so inclined to move back. But yeah, public health is very important. It is.
All right, so I'll bring in. Thank you. I'll bring in Elsie now. Hi, Elsie.
Hello. Thanks for having me. It's really lovely to be here tonight.
Yes, thank you very much, Elsie, for agreeing to be part of this discussion. Can you briefly tell our panelists about what you do?
Okay, so I'm a global health lawyer. I've done a lot of work to do with law and policy surrounding healthcare across different continents. Over the last few months, my work has been heavily focused on legal research and advice on legal protections for healthcare workers. I also work with LAMISE and I head all the health law and policy work and lecture part-time at Accra College of Medicine. I teach medical law and ethics and global public health law. Thank you.
Right. Thank you very much, Elsie. And again, thank you for being part of this panel. So Nana Kofi Kwaki is no stranger to Health Info Africa. And hi, Nana.
Hi, Professor. Thanks for having me.
Yeah, so Nana Kofi is no stranger. You all know him. He's been with us on a number of different occasions. And that is the same for Kwame Sapongasidu. So yeah, they're all part of us today. We're going to have a wonderful discussion. And without wasting much time, Nana Kofi, I want to go to you. I want you to take this first question. So we're currently seeing a rise in COVID-19 related mortalities in Ghana, right? This used not to be the case. So the question I want to ask you is, what can we make of these numbers that we are recording? But before you go on to that, are the numbers we are getting real? You know, because you see so many reports on social media, their anecdotes, it doesn't seem to be matching up to what is being recorded. So first question, are the numbers real? And what can we make of it? Regardless, it's still a rise.
Okay, so as far as Ghana's, especially the mortality data is concerned, for months now, quite a few of us have been expressing concerns about the consistency of that data and whether or not it actually reflects the totality of deaths that have happened around COVID-19 in Ghana. Obviously, you know, if we really wanted to get a proper sense of the toll of COVID-19, we'd be conducting an excess mortality study, which would allow us to really assess, okay, what are the actual deaths from COVID-19? Has all the deaths that have happened from having an overwhelmed health system or people avoiding care or delaying care because hospitals are busy with COVID-19 or because they are worried about going to hospital and getting COVID-19? So if we wanted to get a full picture, that's what we should be doing, like what South Africa is doing. But obviously, every country also does keep a track of deaths among confirmed COVID-19 cases. And that data generally is meant to be representative so that you can actually estimate your case fatality ratio. Now, since really in late July, early August, Ghana Health Service started putting out data that allowed you to actually track back the time between the date a death was reported and the date it actually occurred. They were putting out a graph that allowed you to actually, I don't know if it was intentional, but it was possible to actually deduce the date of occurrence. Now, on a date like August 18th, for example, I think we announced 8 deaths. 6 of those deaths actually happened 30 days prior or much earlier than that. I think August 15th, there were 2 deaths that were announced that time. There were at least 70 days being reported, at least 70 days after they occurred. In late August, that data stopped being, that data was kind of like suppressed, no longer being provided as part of the, when I say suppressed, I mean it's not included in the daily release. And what that meant was that it was no longer possible to track it. But even at the time of the last day where the data was available, the average delay in the data in the time of reporting was 42 days. So there was a question as to whether or not we were getting everything in real time. Manasa Zure actually wrote an article about that because it was also possible to detect the disparity between what was going on the ground and what was being reported nationally, because the regional number, the sum of the regional numbers didn't sum up the national number. And the explanation that has been given is that there is a review process that goes into determining whether a death is from COVID or a death is with COVID. So whether or not COVID is the principal cause or whether there's something else. Kwame Sapongasidu and I have had this conversation many times on air about this particular thing because it's a distinction without a difference, really. we know that if it's a virus, it's not the virus itself that gets you. It's the things that your body does in response to the virus that actually causes death down the line. So the question has been then, where's the line there between the two? And even if there's no line, how many deaths, what's going into the review process? How long does it take, and how many deaths are currently under review? So that brings us to January 2021, where, like you said, anecdotal evidence out there would suggest that there's been quite an uptick in mortality, and that's not reflecting really in the national numbers in any representative sense. This morning, I was on a program with the General Secretary of the Ghana Medical Association, and he basically said the same thing, that we know the numbers are not representative, so we have to make sure that they are, so we can calculate an appropriate case fatality ratio, and so that people will be aware. Because one of the other lines of pushback in the public domain about COVID restrictions or the need to take this seriously is this line, people are not dying, which has never really been true. A lot of people have died. January 2020, we've seen a significant uptick. And if that's something that allows people to understand the gravity of the situation, from a risk communication perspective, it makes sense for that to be put out. Yeah.
Now, Kofi, let me bring in Kwame to share some thoughts on this, the mortality, the numbers.
Yeah, it's interesting. I'm actually looking on the Ghana Health Service website, and it would amaze you to know that since the morning of Thursday, that we're giving the data for the 25th of January, there's not been any update. So we're going into 72 hours now, and Ghana's figures haven't been updated. So if you've heard of any death or someone testing positive or anything like that, and you are thinking that that will show in the numbers, the reality is our numbers, today is the 30th, we have data for the 25th, so our numbers are 5 days at bay. What does that do? What it does is that it affects the risk communication in the sense that a lot of people are looking at the numbers and they are thinking, oh, ever since we got to 3,940 active cases and 390 deaths, there haven't been any new deaths. And so it makes you think, oh, perhaps the disease has slowed down. The reality is, if you speak to colleagues who work in Noguchi and other testing facilities, they tell you they are getting more and more positives. I mean, on that particular Thursday, Confanoche reported that in the week that we're just coming to an end of, they were getting something like a positivity percentage of 49.8%, which is huge. And therefore, the mortalities are not going to be estimated accurately, but are going to continue happening unless we get all these data anomalies streamlined. Because if they are not, you are only doing pie in the sky estimation and calculation. Yes, the Ghana Health Service might tell us that they have the up-to-date data, but if that is the case, they are telling us to just believe them because we don't have the up-to-date data. So every time you're talking, not too sure about where exactly the country sits. And that makes this whole mortality conversation a bit tricky.
All right, thank you very much. I'll call on you to address something else that is going on in the news this week. But at this point, I want to bring on A4 to take the next section, or what is currently going on in the news. So A4, you remember, or recently there have been reports of children getting infected with COVID-19, and there was a particular report at Confanoche Teaching Hospital. The news or the previous communications made it appear as if, children were immune. So what do you make of these new developments? Should we be changing our messaging, our communication about COVID?
So I don't think the previous message was that children were immune. Largely what it was is that children would catch COVID, but the majority of them would be asymptomatic. So for them, the danger was, even though they weren't showing symptoms, they could spread COVID to their parents, to other people who were more vulnerable, and they would show symptoms. I don't know what the data is on the number of infections in children currently in Ghana. But I mean, what I think is that we're seeing a surge. I mean, generally numbers are going up, and initially I've seen figures of the rate of infection in children from 2.2, 8.7 in different places, not mentioned in this country. But the fact is that it's a proportion. So if your numbers are going up, and you, even if you are still staying at 2.2, 2.2 of 100 is definitely more than 2.2 of 10. You know, so maybe this may account for the increased number of children we're seeing who are showing symptoms. It's not like they are catching it. It's a different. They've always caught COVID. It's just that they are less likely to get severe disease. They are less likely to show symptoms. Then again, the truth holds that also in children with underlying disease, you have them more likely to get severe COVID, more likely to show symptoms. But they've always that's been the problem with schools being open. They are asymptomatic carriers, so they will be fine and give the disease to their parents, their carers, their teachers. So that's always been the problem. I don't think there was ever a communication that children don't get COVID.
Okay, all right. Thank you very much. Whilst we're on this issue, I'd want us to talk a little about school reopenings. Have there been any new developments on school reopenings regarding testing? Nana Kofi will make a statement on this. On this later when it comes to workplace infections and all that. Do you have any advice for parents who are having their kids go to school?
This is a very tough question to deal with. I mean, I've had friends call to ask for advice. Should I send my child back? It's difficult. A lot of mothers nowadays are working mothers, working fathers. So organizing childcare when you're not home, or even worse, when you're trying to work from home and you have children around, having to guide them through this long distance learning, it's a difficult thing. And I mean, I think the information, as you said, there was an information lag, and it seems people prepared for school, paying school fees, prepare their children for school before it seems like this spike suddenly came out of nowhere. So people are even thinking, paid school fees, what happens to the school fees? But for me, my advice has consistently been, if you are in a position to continue to take care of the children at home, keep them at home for now. That's my advice. I mean, it's everyone's circumstance is different, and so I can't say if you have no one to take care of the child, definitely don't send them to school and stay home. And I mean, if you are in a position to be able to take care of your children from home, I think you should be. I mean, a lot of schools are still doing hybrid models, or still offering the classes over the net. So if you're in a position to be able to provide childcare for your children at home, I think you should take that option. Let's see what happens in the next few months.
Okay. All right. Thank you very much. Now, can I bring on Kwame? Kwame, there's this particular issue that I saw you talk about on social media, hydrogen peroxide. So again, we're in a situation where there is some information that hydrogen peroxide does some magic. And then all of a sudden, everybody's rushing for hydrogen peroxide. And the FDA in Ghana had to put a statement out warning people about hydrogen peroxide, being substandard on the market. What do you have to say about this craze for hydrogen peroxide now?
Yes, and it's interesting. This is about the third time I've been asked this question. And as what do you call it, a pharmaceutical chemist, I've always said that one of the challenges I had in my days as a lecturer was the fact that serial dilutions, even students of pharmacy struggled with serial dilution. It was one question that in the lab, you knew that a lot of people were going to have challenges with. Considering that we have hydrogen peroxide on the market, either 9% or 6%, and those are concentrations that are highly corrosive and can, corrode your oral surfaces, your oral mucosa and your nasal passages. I have had a considerable amount of worry as to how to dilute it properly to get at least 1% or 1.5%, or if they are using it for the oral passages, 0.5%. So that is a caution from a professional standpoint. Now let's look at the actual virological standpoint. Does hydrogen peroxide have viral properties? Yes, it does. Is there evidence in the data that it has been used for virucidal properties? Yes, there is. I mean, I was looking at the British Medical Journal the other day, and there's some evidence. Nature, and there's some evidence. I've looked at Science Direct, there's some evidence. The instructive thing, however, Kwame, is the fact that all three serious journals conclude that there is insufficient evidence to actually support the role of hydrogen peroxide in the fight against COVID. Now, that's the point. These three same journals were the same journals where, when the issue of wearing of face masks vis-a-vis this pandemic being spread through aerosolized particles and being an airborne disease, said there was not sufficient evidence. And then as this evidence started evolving, they started moving and said it was airborne, transmitted, and eventually to the point where they said that face masks had a serious role to play. So when I look at the theory of hydrogen peroxide and I look at the practicality of the fact that these journals are journals where if there's no evidence, would put their neck out and say, look, this thing wouldn't work. I have said that on the basis of it having virucidal properties, there's nothing wrong with gargling hydrogen peroxide. I mean, people have been gargling it for God knows when, but on condition that it is part of all the protocols, because it's not a magic bullet, it's not a magic wand, but it could have a role. So, for example, if you've had deposition of viruses in your mouth and you gargled hydrogen peroxide, it could help prevent them from multiplying because we know that it has that property. My concern is how it's being peddled and the fact that pharmacies like you and me have allowed to sell so easily, to find that there is a shortage in the country and people are putting fake ones on the market. That concerns me a lot because you're dealing with something that is harmful. Hydrogen peroxide is corrosive and it's harmful, and we can never run away from that fact. So even if it's going to be helpful, it may be an opportunity for pharmacies to be doing the dilution themselves so people can obtain it in the diluted form rather than buy the concentrate of 6%, which is 30 volumes, 20 volumes, or 9%, which is 30 volumes, and try and dilute it. Next minute, we'll be trying to cure or prevent COVID. We'll have a lot of people with dental problems because the enamel of their teeth has been corroded and all that. We cannot solve one problem and create another. And that is how I see this hydrogen peroxide conversation.
So thank you very much. And Kwame has said we cannot solve one problem and create another problem. Also, this week in COVID news in Ghana, our parliamentarians are doing some magic. The Speaker of Parliament indicated that there was an outbreak or some parliamentarians had contracted COVID. And then again, this report came out that some parliamentarians were refusing to get tested for COVID-19. I want to bring Elsie in to talk about this from the legal point of view. So, Elsie, is there anything or is there any law that these parliamentarians are breaking by refusing to get tested, even though they know there is an outbreak? Are they not putting others in danger? And is it not really setting a bad example for the general public as a whole?
Absolutely, it is setting a bad example. We have the Public Health Act 2012, yes. And under that Public Health Act, there's an executive instrument which was passed on the 23rd of March last year. And it's very clear about preventative measures that should be taken it's also very clear about testing and quarantine directives. And it's as clear as day. It says a person who shows symptoms of COVID-19 shall be tested for COVID-19 and put under quarantine as may be necessary. So if they're showing symptoms or there's a need for them to test because they've been in contact with someone with symptoms, then they absolutely need to test, and that's mandated by law. And so by refusing to do so, they are indeed breaking the law.
Yeah, so they are indeed breaking the law, as Elsie said. But here's the question: who watches the watchman? I mean, it's an issue that we have to. So again, we have to mount pressure on our leaders. This is where sometimes civil society organizations have to come in and then help us address some of these issues.
Absolutely.
Now, one other thing that has come up in this week has to do with the free testing. So there was a communication. Again, we have so many things coming up. There was a communication that alluded to the fact that you could now get testing free at public institutions. And I want to bring in Nana Kofi. What does this really mean? Is this as is being talked about, or there are some caveats to this particular, testing that we're talking about?
Okay, so the communique from the Ministry of Health was basically directing the different public labs that have been doing testing so far to look at their current policies and make sure that they were providing those tests for free. Now, I think the day before that circular came out, so one of the press briefings, that question was asked to the Director General of the Ghana Health Service, and he actually said at the time that all testing at public labs was already free. So it was a little difficult to understand what the actual policy change was there. But it did seem as though in the original circular that what they were saying was that you could come in and with walk-in requests, that's the phrasing they used, and get a COVID-19 test. And the implication there was basically that you could come there and voluntarily get tested of your own accord. The next day, however, at the press briefing that the Ghana Health Service did, they clarified that that public testing for free would only be available for people who either had a referral from a physician, had been directly contacted as part of the Ghana Health Service contact tracing efforts. Those are the principal categories of people who are going to be able to access that free testing. So it's not like it's not like if you're at home and you say, you have a sick relative at home, if you've not been actually contacted by the Ghana Health Service, you won't be able to go and access that free testing. And that creates the two bottlenecks of A, if you are sick, having to go get a referral from a physician before you can get tested, and B, which obviously then creates the risk that you're going to take the sickness into the hospital, infect other people, infect the physician. And then B is a scenario where if you know you're exposed but have not yet been contacted by Ghana Health Services contact tracing team, you would have to basically sit out on such a time. Otherwise, you would have to go and then pay whatever fees they're charging. And at some of the labs, I mean, they were charging 350 CDs for tests, which is basically like going to a private lab for a 24-hour test. So net, it's hard to understand what actually changed on the ground. It seems more like a reminder to the public labs that they are not supposed to be charging for those particular situations, but because of the inherent bottlenecks in what the communique and the clarification says, it doesn't really markedly improve access to testing per se.
We have it from Nana Kofi. It looks like nothing has really changed, but it was made to appear as if there were a lot of changes. So I want us to switch gears and talk about the next section, which is the burden on our healthcare system. Before I go on to that, or to seek the views of the panelists, I want to play a short video, and we're giving credit to Joy FM for this particular piece.
We have been told that we cannot refuse care to anybody. So I think our facilities are doing their best not to return anybody who walks into the facility being ill. And by so doing, they are also increasing the exposure rates of every other person around. It's been almost a week now, but nobody has been called or contacted about testing the staff nor the relatives. A lot of us are embittered by it. We keep complaining, we keep passing comments. But I mean, we can only talk in the background. If there is anything that can be done, it is about management helping us out.
A nurse who spoke on condition of anonymity says the over 400 caregivers are compelled to work without the right protective gear. She says the development puts their immediate families and that of the public at risk.
There has been a clear line in that we should have frontline health workers who have been trained specifically for the management of COVID-19. But as it stands, it looks like every health worker is capable of managing COVID-19 at any little space on the ward, which is not supposed to be so. It exposes both the patient, the health workers, as well as the relatives who come around these patients.
So there you have it. It's a worrying concern. When you listen to the rest of the piece, which I will admonish all our listeners to do, she goes on to talk about how sometimes you have to manage COVID-19 positive patients next to patients who haven't tested positive for COVID-19 or who are negative. And we know the risks. There are people who are sick. There are other conditions. They will have other comorbidities. Why would we want to expose them to, COVID-19? It looks like some of our hospitals are becoming super spreader sites for COVID-19. And this is quite concerning. I'd want to bring in Afua to share her thoughts on this issue.
I don't know where to start. I mean, having been in this situation before, it's difficult when you're working on the front lines to reconcile what is the numbers that are being spouted on TV and what is really happening day to day on the wards and the clinics. As one of the people in the interview rightly said, when it comes to pandemics, every health worker is a frontline worker. There's no distinction between patients don't come pre-tagged. This person has COVID, this person does not. And I mean, it's something that really frustrates me a lot of times because it's so. And initially, you could say we were caught unawares. I mean, we weren't the only country with PPE problems. We weren't the only country with testing problems. But this second wave has been predicted. This shouldn't have caught us by surprise. So I really don't understand how we managed to sit on our hands, hoping and praying for the best, which is something that we do quite well in this country, and waited until this was upon us again for people to complain about it. I mean, when it comes down to it, health workers are human beings as well with families, and they live with vulnerable people. They can be spreaders of the disease as well. So when you don't protect them, you are essentially giving the disease a chance to spread, because hospitals are where sick people aggregate. So if someone is not feeling well and they're going to come, and most of the times, I mean, most people who've called complaining, they never say, oh, I think I have, it's always, oh, I think I have malaria. And you go like, in this day and age, go and do a COVID test. And invariably, in more often than not, this is positive. So you can imagine the number of people that are walking into the health centers, into hospitals, into clinics, presenting with these symptoms. And because certain people are not categorized as frontline health workers, they are not given certain protections. They are not given access to certain tests. I mean, there was this policy in a lot of hospitals where if you were not symptomatic, and even if you had been in contact with someone who had proven COVID, you were still supposed to come to work. I mean, I understand that it was a matter of staffing. At a point, it was, I mean, the numbers were getting out of control, but I think we've had more time to prepare. We should have been doing better by now.
Yeah, so like Ifwa said, we had more time to prepare. Let me bring in Kwame to talk about this.
I find it a bit worrying. And the reason why I find it worrying is the fact that at the start of this pandemic, we're all told that you have to test, trace, and isolate. Without testing, you cannot find the people who are infected. If you find the people who are infected and you don't trace, you cannot short-circuit the community spread. And if you test and you find the people who are positive and you trace and they are infected and you don't isolate them, you're not dealing with the problem. Now we find ourselves in a situation whereby even health workers are struggling to get tested. The good thing is that now that we are having an uptick, we seem to be testing a lot more. The question I ask myself is, do we have to always be chasing the pandemic? Was it not too obvious that if the nature of the pandemic was going to change in the country, the only way we're going to pick it, especially with our health-seeking behavior, was through testing? Because like the other colleagues have been saying, a lot of people think they have malaria because the case definition fits malaria as well in so many things. But in this era, you don't think malaria, you think COVID. The other thing is a lot of them are going to pharmacy shops and not even not going to health facilities and getting all these medicines and all that to self-medicate. If the pharmacies don't have a means of advising you to go and seek testing and signposting you to a health facility where you can be tested for free, and they tell you that, oh, I suspect that this might be more than malaria, go and get yourself tested, and turn around and tell you that you've got to pay 300 to 1,000 cedis. The next question the person will ask you, if they had that sort of money, they wouldn't have come to the pharmacy shop, they would have gone to a health facility.
Right.
And if we continue to do this, we are short-circuiting the fact. And if we continue to short-circuit the fact, this uptick would not cease. And for me, this is one of the biggest things we have to be honest and call a spade and deal with at this point in time. Because without it, our hospitals would continue to be full.
Yeah. Let me take a brief word from Nana Kofi under a minute, if you can just add to this discussion.
I think we're at a point where, like Kwame said, we again, as we always say on the show, we need some candor about the reality on the ground. We need to be factual about what's going on. We are hearing from every person in senior leadership at every medical facility around the country that they are under duress, that they are under extreme duress. This morning, Dr. Yankton actually said that the healthcare system was on its knees. That's the actual phrasing he used. We need to be clear about that, because it's not. We have to then identify the fundamental cause, which is the transmission. If we can't figure out a way to stop that, we will continue to get these infections going on. Now, as was said in the clip, we cannot keep doing this because healthcare worker exposure is way too high right now. We have a moral responsibility as a country not to put people in a situation where they are facing an avoidable risk. We could have planned for this, we could have put in better measures. And if we are here now and they are faced with that risk in the healthcare system, then we have to deal with it on the transmission side. And then obviously we also have to get it done because so many people, I have elderly relatives who otherwise should be getting, bi-monthly checkups for long-term conditions. Most of them have not gone to get any of those things in the last year because they are worried about going to hospitals where they might catch COVID. And even now, in most of those facilities, even if they went, the hospitals are too busy to actually provide that care. We need to solve that problem too, because those people too cannot get left down by the healthcare system. And because this is a situation that was avoidable, but if we are here now and we can't deal with it by a rapid expansion of healthcare delivery, rapid provision of PPE, then we have to be serious about what we can do to stop transmission. And that has to become an absolute priority in this fight in the short term.
All right. Thank you very much. Elsie, we need you here with the legal discussions. So clearly over here, there are two things that are going on. Healthcare workers are being put in danger, right? Patients are being put in danger because they are obviously being exposed to, COVID-19. So what do the laws offer to what you call it patients in terms of protection? Their rights. What are the rights of patients? According to our laws, how can they access the information that would equip them to I mean be able to know their rights? I don't even know how to talk about this.
So we have a patient's rights charter, which is embedded within our public health law. Now, I want to say that, especially when it comes to infectious diseases, you can't have patients' rights without healthcare workers' rights. In one sense, yes, healthcare workers have obligations to patients to ensure that they are safe, they get the treatment they came there for. But if at the moment the situation we are describing is the actual healthcare workers being agents of transmission, then we're starting from ground zero, really. Because if healthcare workers are not protected properly, then it increases the risk of health associated infections, which people will get from the facilities. So at the moment, we need to look at the legal framework that we have, also the policy framework that is in place. So we have the Public Health Act, which actually transplants the whole international health regulations, which is an international health treaty that the WHO passed. So the WHO has only three treaties or three international laws that are binding on all member states. So there's the Framework Convention on Tobacco Control, there's the International Health Regulations, and then there's the WHO Constitution itself. The WHO Constitution talks about the right to health. Now, that right to health is also within our African People's Charter on Human Rights. And it says that every person has a right to health. And even our Ghanaian Constitution makes allusion to the right to health care and the right to life, which are both interlinked. Okay. So here's the case where healthcare workers are very much at risk. So their lives are in danger. But then at the same time, they have a duty to look after the patients as well. We have a national infection prevention and control policy. The policy clearly states that all staff should be provided with all the PPE and scrubs and everything that they need, and that they should wear it as soon as they come in. It's said hand hygiene, all these things are talked about. So the question we really need to ask is, what are government's investments in healthcare at the moment? Where are the priorities? Because we have a situation here where the facilities are massively understaffed. People are also scared of losing their jobs because if for some health professionals, it's likely that some of them could lose their registration if they speak up too loudly about these things. And so we really need to have a look at, how we really protect healthcare workers, which will inevitably take care of patients as well.
Okay, so while we're on this issue, I want you to talk about this. Are there any channels that are available to patients or even healthcare workers if they want to, follow up some of these using legal channels?
Well, the thing is, the law hasn't been tested enough. So we don't have enough precedent to go by where we can say that, oh, in such and such a case, when this happens, this is what is likely to happen. And so people have a sort of a point of reference where they can go back to and say, okay, maybe we shouldn't be doing this because there's precedent there to show that this is what would happen. But I know that the MDC possibly has some channels of like a complaints ombudsman of some sort. But I don't know how well that is, how well oiled that machinery is, for lack of a better phrase. And so I think that rather we need to carry on with advocacy, getting the CSOs involved, also raising awareness within our own circles, because at the moment the legal process is tedious, it'll take years, and so we need to think about things we can do now to ensure that these things are enforced.
All right, thank you very much. And yeah, it's concerning. We are not only dealing with the pandemic, there are so many other issues that we have to address as well. So when Ifra was speaking, you could actually tell that she really feels what is going on as a health worker, as a doctor. I just want to bring that back on. I could tell that it was taking an emotional toll on her as she was even speaking. But it's not just emotional. I mean, it's physical as well. Can you talk to this? How is it impacting healthcare workers who are on the front lines?
Okay, so I work as a doctor. My husband is a doctor. I have relatives who are doctors and nurses and midwives. So when I talk about these things, it's from a point of frustration. It's one of the reasons why I went into public health and healthcare management. For me, the reason is, what are other people doing elsewhere, and why is it that we cannot implement these systems in our country? I also talk from a place of experience, because before we had COVID, we had the threat of Ebola, which by God's grace did not manifest here. And I mean, I was put in a situation where I literally had to talk to someone who was tagged as a suspected Ebola case, and we had no training. This COVID is actually an improvement on what was happening with Ebola. And I was in Greater Accra. I wasn't in some district somewhere. So you can imagine that if this is what is happening in the capital, it's obviously 10 times worse elsewhere. When it comes to the effects of the pandemic on doctors, I mean, it's been shown even before the pandemic that when healthcare workers are put in high stress situations, there's increased risk of stress, increased risk of burnout, increased risk of anxiety. In this pandemic, you also have the risk to their physical bodies of catching the disease. And the anxiety is compounded by, even if I catch the disease and I'm fine, am I going to give it to my loved ones? You have places where healthcare workers live in separate places from their families, just so they don't transmit it to someone in their families. And you can imagine, I mean, under these conditions where all you want to go home and do is get a hug from your husband, get a hug from your children, get a hug from your mom, you're not able to do this because that hug could potentially kill them, So I think what it is that this pandemic has further exposed the weakness in our management of mental and physical health of health workers. I mean, the provision of psychological support to them when there are high stresses, there are high stress events. So this is just everything. Everything is on steroids. Everything is times 1,000 now. Yes, that's what it is.
Yeah, so viewers and listeners, you could tell the emotion with which Ifwa spoke. It's personal. So the little we can do as citizens is to keep observing the safety protocols, keep ourselves safe, protect them. I mean, protect ourselves. Reduce the pressure on our healthcare workers. So, Kwame, you've been talking about the trajectory we are on. If we keep on this path, where everything is, overwhelmed, the burden and all that. This is something you and Nana Kofi have talked about incessantly. Where are we heading with all our, ICUs overburdened, healthcare workers are not even getting the testing? Where are we heading with this? I think you're muted. If you could please unmute
I said, where do I start? Okay, let's do a few numbers. So at the moment, our reproductive number is 1.45 across the country. It's between 1.2 and 1.6, but generally 1.45, with it being about 1.6 in Greater Accra. Our doubling rate, which is the number of days it takes for active cases to double, is 6.5 days, and it's been decreasing. It used to be around 9 days, and now it's come to 6.5 days. And you just need to check from the last time the president spoke to us and where we were to where we were a week later, and you would know that we're 1,700, and a week later, which was last weekend when we're speaking on this program, we're almost at 3,400. That is a worry. Then you look at the last week. The average number of cases in a day is 627. Every single day, we're recording 627 cases. And you realize that we have said that we are not testing enough. So that gives you an idea of, even without testing, how many cases we are picking. But in line with this is also an increase in our positivity rate. If you look at our composite positivity rate, over the last week, it's 10.1%. If you disaggregate it and you realize that the airport is just about 1.3, 1.4%, we are in country looking at about 18, 19%. That is concerning. So you look at all the underlying epidemiological trackers and you're like, this ain't tracking well. So the next thing is, if we let this continue. If we let this continue, these are the risks. Now we all know that when it comes to COVID, because the wild exposure gives you, what do you call it? Immunity for up to 5, maximum is 3 to 8 months, but let's say a mean of 5 months. Technically, anyone who got COVID at the beginning could get reinfected. So our susceptibility population is not going to change appreciably because we are getting reinfected. We'll just be recycling it, which then means that we're going to get a lot of people exposed to these things. And with the data coming from long COVID, the more we get people exposed to these things and the more they start getting all the respiratory problems, the endocrine problems, the renal problems, the cardiovascular problems, the more we saddle our public health with long-term chronic diseases. We can't even deal with the chronic diseases we have currently. Like Nana Kofi said, people are even scared of going into the health facility. So why would we even want this pandemic to leave us with such a legacy? And for me, that is the biggest thing, as to if we continue down this trajectory, we are actually going to be staring into the abyss. Because, as we've all agreed, we don't know when the first vial of vaccine is dropping in Ghana. And even if it drops, we don't know when we'll get enough vaccine to immunize to get to our herd immunity threshold of 75%, which is about 23 million Ghanaians. Even if you say you're going to disaggregate women and children under the age of 16, pregnant women and children under the age of 16, you still have to deal with 55% of the population. So whatever you look at, any way you turn the numbers, it comes to one thing: we need to protect ourselves, because the trajectory we're on isn't good. And the problem is, some of these numbers are not being told to our faces the way I think they should be told to our faces for us to look. I mean, I'll end on this note. If you look from the beginning of January till now, we've had over 40 deaths. If you look at it from the point of view that we have just under 400 deaths, it means that 10% of all our mortalities due to COVID have happened in 1 month. What does that tell you? The trajectory is not good.
So the trajectory isn't good. Nana Kofi, I want to take your views on this situation. You've talked at length about this in one of our discussions. You talked about the ICU capacities and then the numbers. Can you talk about this?
Well, I mean, in addition to everything Kwame has said, obviously there is a quite alarming prospect of what is actually driving the spread on a fundamental level, which all the evidence on the ground would suggest may be the South Africa strain that actually is becoming more dominant. Yesterday, the regional director for WHO Africa commented that this is something that actually, as she said, keeps her up at night. The fact that, there are so many countries outside the continent that have confirmed the virus being present, and that there are so many of the ones that have in Africa that have confirmed it being present, the speed at which that strain has become dominant has been mind-blowing. And what she was expressing was the concern that we talk about here sometimes. What are the odds that you would detect 2 of the new strains among travelers arriving at Kotoka, and that all the ones that you could possibly ever have imported in the country were those ones you identified? That's not practical thinking. We know that very likely this strain is in circulation It would explain why we're seeing so many young people coming in need of much more, coming in with severe and critical illness. It would explain why the reproduction number is going up while the doubling rate is coming down, because it's 50 to 70% more infectious as well. And if you look at all those things on the ground and you think about what that means if we don't figure out a way to slow down these transmissions, it means that the pressure on the healthcare system, that is also going to be increasing exponentially. But the capacity of that system to get people out of there, because of the limitations of time and energy and also just disease progression, it's not going to work out for lots of people. And if we have a situation where as we are starting to see people, Dr. Yancey actually gave this example today on air, that he had a patient yesterday he was trying to find a critical care bed for, tried a couple of facilities. This is the General Secretary of the Ghana Medical Association. Couldn't find a bed for this person, and the person passed overnight. These stories are becoming more common. And we have to understand that if we want to avoid, as Kwame says, staring into the abyss, looking at a very, very ugly picture like what Brazil is seeing, like what South Africa is seeing, then we have to get serious. We have to be honest about what we are looking at. We have to communicate this issue with some intellectual honesty about the gravity of the matter. And we have to be straightforward about the things that must happen if the transmissions do not slow down in the short term. Without any of that, we will continue to see these increasing infections, and the obvious outcomes there will definitely play out.
Okay, so there you have it. Another issue, I mean, the issues are just so many. I don't know how we're even going to be able to deal with all of them now. Also, on the pressure on our healthcare system, now we have challenges with getting some pharmaceutical, products, and also even oxygen tanks, oxygen concentrators. Now it's a challenge. Now it looks like the wealthy people, just like how the wealthy countries overtook the vaccines, some of these items are just being purchased by people who can afford to, and it's leaving our system in dire need. I want to invite comments from Nana Kofi. So is there anything that we can do to prevent the pressure that is being put, the extra pressure being put on our healthcare system due to the fact that some of these are not available again because some people are just getting them?
Well, yeah, I mean, we know, for example, that there's lots of private sale of oxygen going on. We know that when it comes to even some of the protective equipment, N95 masks and face shields and all that kind of stuff, that those are being purchased by people who can afford them, and being put down for in case they might need them. We need to, I'm not exactly clear on what the law permits, but I would hope that there could be some thinking about making sure that we could regulate the pricing and at least have some short-term, economic and financial policy in place that make it so that people cannot, partake in this kind of profiteering and price gouging at this level. Because it's not that there's no oxygen anywhere in Accra, it's that the oxygen is now going to the highest bidders, and those high bidders are hoarding it. And it means that people who otherwise should be able to get affordable oxygen that's purchased by the facilities and readily available to them aren't getting it because those facilities are being outbid in the open market for this critical life-saving stuff. That's even true of things like the oxygen flow meters that you put on those tanks. Those used to sell for about 75 cedis, I think, in some places, even last year. Right now, the place that will sell to you for 750, the range is from all the way from 300 going. We need to actually think about what that means also as the professionals who are doing these things, because there is no logic, there's no way we're going to be able to solve this problem if we are not working as a collective society, trying to do the things we need to do together. It's the same thing with the mask wearing issue. It comes down to whether or not people understand that if one of us is vulnerable, then we are all vulnerable. The fact that hospitals are competing with you, the oxygen with wealthy people for the oxygen that you, the oxygen supplier, is selling, means that it might be the case that if you have an emergency, you will be at a hospital that has no oxygen before somebody can get to your place to get you the oxygen from your own warehouse.
Right.
So we need to think more honestly about this and make sure that if there's things that can be done to regulate sales, to keep pricing consistent, and transparent around the country, then those things have to happen. I'm not sure what the law says there, but I would hope that that something could be done there, because otherwise the profiteering incentive and the gross inequality in our society means that the people who are most likely to get COVID because they can't stay home, they have to go to crowded places to work, are the ones who also, if they get severe illness, will have the least ability to get life-saving and life-supporting care.
Yeah, so the inequities in our healthcare system are showing. Nana Kofi said he doesn't know what it is from the legal standpoint, but we have Elsie here, and I wanted to share her views on this. Hi, Elsie.
Hi. Yes, so the law is a little bit sketchy on that particular point of price gouging. But I do know that there's an act from, I think, Act 589 from the year 2000, which talks about unfair competition. And there's a section there that talks about unfair competition in respect of national and international obligations. From what Anakofi is describing, I think that's a section that might fit best with that. But in terms of the consumer and the legal framework for consumers, I think there's a lot more clarity that needs to come, especially with regards to the different price hikes we have when depending upon what is happening within the country. So there's plenty there that needs to be addressed. It also highlights the need for a lot of corruption within the system to be weeded out, because I won't be surprised if this issue is not being looked at immediately, because there are some people who may be benefiting from the situation as it stands. So I hope that this video goes far and wide, and we can call the legislators to be able to bring out something specifically addressing this.
Yeah, thank you, Elsie. Kwame, you know, I wouldn't have let this go without bringing you in. So,
well, you see, there's something about honesty that I always struggle with when it comes to Ghana. And why do I say so? Nana Kofi is talking about the price hikes, the price gouging and all that. I was talking earlier about the fact that pharmacists have allowed hydrogen peroxide to run out of stock and all that. And clearly they would have sold at some outrageous prices. Now here's the thing. Where does the whole candor, dishonesty conversation start from? Nana Kofi, when he was speaking, was saying that he thinks they are some of the variants in the country. He thinks. I know. I'm not saying I think. I know. And this is how I know. Africa CDC has announced on their website, and I've got a communique, that scientists in Ghana have found a thing in our communities. I have known since Wednesday that was the case and that it had been found. Our Ghana Health Service hasn't announced it, but Africa CDC has announced it. Meanwhile, we are the ones who are bearing the brunt of the speed and acceleration of contagion. So if the people who are supposed to tell us in candor the changing face of this pandemic are unable to tell us, who is watching the watchman? And how then do we turn around and go and tell the person who is selling oxygen that bring down your prices, when the person who is in charge of bringing the whole pandemic down cannot even tell us that there are a number of variants in the country? So what do you call it? Get serious. And I have to go onto Africa CDC website to go and get the information. You see, so there is some level of inept dishonesty that has become part of our professional body fabric. And it runs through our politics, through our professionalism, and through our business. The only problem is when it affects us from one quarter, now it's affecting us from the business angle because people are holding oxygen, we start shouting. But we forget that when we do it in our professional environments, it's fine. Unless we have that level playing field where we see all these things across the paste as unhelpful, we would always be having these conversations.
All right, thank you very much. Thank you very much, Kwame. Those were some really heavy words. I want to take a break, and when we come back, we will continue.
It is the senior most community pharmacist, Dr. Tuli.
Tompo Asembeng.
Oh, no lie. Then I say if your driver can't pick you, I make you people give me lift go. Shackers inside now. I'm at say so on link copy. But
Tompo, 11 p.m.
Oh, if it comes a seed in the who give me. I guess some entanglement before that side.
You know they hear social distancing, eh?
To leap from D, same crowd, the whole. As I be young in the Amazon, I did cool. If you no go pick me to catch him in small left.
See, this be the problem. Who tell you say corona affects youngins? If you know they care about your life, if a guy say NSL be over 50 years, away get hypertension, where poppy to be diabetic. Charlie them their go mess them up.
You are go wear face shield.
And that changes anything? That thing they protect only your eyes.
Plus face mask.
Charlie, the youth will take this thing for granted. It may not kill you, but if it give you long-term damage to vital organs like your lungs, if you go get for outside cargo house, they give your OGs where them die. Will you be able to fend for yourself?
Chama, so I can say because unless I start they do Yahoo, I enter Benino, na phone cost me this the COVID-19 make it left one at top hole.
If people know they follow simple directions like social distancing, hand washing, wearing face mask and things, the COVID no go anywhere. And the way they make careless there, it be like you no go left with anytime soon.
So to say my shadow make beans eh?
If you love yourself and the people around you, they house and take your shadow go do go back cry.
You are here, you more like dog me. So they kill my vibe cry.
But we take responsibility and keep fighting with positivity.
All right, thank you very much. We're back. We're back from our short break. It's been an informative discussion, quite heavy at times, but we need to go on. This is a big fight, but we're going to soldier on. So now I want us to switch back and talk about vaccines. We've had a lot going on, and I want to know from our panelists, what are we doing on the vaccine front? I know Nana Kofi has been following the information on this. I want to hear what he has to say about the regional response, ECOWAS, and then the AU. Nana Kofi.
Yeah, so Ghana in particular is relying on a couple of different facilities to get the COVID-19 vaccines in-house. We're relying primarily on the COVAX facility, which is sponsored by Gavi in partnership with the WHO, which is meant to provide vaccinations to about 20% of the population in a select number of low and middle income countries, Ghana being one of them. So we're expecting to get about 20% of the population covered through there. The next option we have, or the next channel that the vaccines will be coming through, will be what we call the African Vaccine Acquisition Task Force, that was put together by Cyril Ramaphosa, and the folks at the AU. What they are doing is basically to go out there, use the collective bargaining power of the AU to try and acquire the vaccines in the open market. And they've been successful too. If you take African countries in general, from the COVAX facility, they secured about 270 doses, but from the 270 million doses, but from the African Vaccine Acquisition Initiative, they've been able to get about 600 million more. Now, a lot of that is going to be rolled out all the way through 2023. That's the challenge there. None of that is going to all be available at the same time. And what that still means is that for a country like Ghana that's relying primarily on those two streams, we will probably be able to begin immunization of frontline healthcare workers in the middle of this year at scale, but we will not be in a position to be offering the vast majority of the public the vaccine until well into the end of 2022, if not 2023. Unless, of course, the regional efforts at ECOWAS level, at AU level, can be scaled up to get more vaccine. The ECOWAS group is also working on their own plan. And also, if the patent rules are suspended so that all the different pharmaceutical companies around the world, the thousands who could actually be manufacturing the COVID-19 vaccine, if they knew how, they can also come online. That is something that could really improve access. But as it stands, if we're relying primarily on AVAT and on COVAX, then we can expect to start seeing vaccines in proper circulation and proper coverage sometime late next year in 2022.
Yeah, that's quite worrying. And that is not the only issue we have when it comes to vaccines. We're going to have, the vaccine hesitancy. We need to do some public education. I want to bring in Angela to address this issue. Hi, Angela. I think your mic is muted. If you could
Oh, hi. Good to be back with you guys. And thank you all for the great comments. So, on the issue of vaccine hesitancy, I just wanted to encourage all of us. I'm sure each of us knows someone who knows someone that we can really educate on the benefits of the vaccine. Like I tell some of my patients, the worst that can happen is actually getting COVID. Great. You may not end up dying from COVID, but there is what we call post COVID syndrome, which is real. Some people are still reeling from the effects of COVID-19. There's memory impairment, some people have brain fogginess, and a slew of other symptoms, even months after recovering from COVID. So I would say that if and when a vaccine becomes available in Ghana, I would encourage everyone to get the shot. I got my 2 doses and I did fairly okay. The reaction was mainly injection site reactions. I had a sore arm for a few hours. It was very transient. Next morning, I woke up and my arm was okay. And the feedback we get from most of our patients who are returning for their second doses is that, oh, I did pretty good with the first dose. So there haven't been any major issues with the vaccine administration itself. Of course, we all anticipated that the side effects were going to be limited to injection site reactions. So the muscle soreness, the achiness, the lethargy, and things like that. But as of right now, we haven't seen anything out of the ordinary. So again, we can't stress this enough. The only way we can get back to some semblance of normalcy is if we have some form of herd immunity. So at this point, since the disease is spreading at a really fast rate. So I think what we can do to get back to that semblance of normalcy is to get vaccinated if and when a vaccine becomes available in Ghana.
Okay, so Angie, before you leave or before you wrap up this section, I have there's a question that I want to ask. What about the videos that are going on about some of these vaccines? I mean, you remember the first video that came with the nurse that passed out after taking the shot?
Right.
It's still in circulation. There are others that are going on. What do you have to say?
So, I mean, like any other therapy or treatment, there are going to be side effects. Some people take good old benign amlodipine and they have dizziness, they have headache, and they vow not to take that medication again. So, it is expected that a certain number of the population is going to have side effects. I'm not ignoring that. It's good to have those numbers so that we can have robust data on the actual number of people who have side effects from a therapy. So with that video going around, we actually had an example in a vaccine clinic. There was a gentleman who was waiting to get his first dose of the Pfizer vaccine. No, actually, there was a lady who got her first dose of the Pfizer vaccine. So we usually have an observation area where people have to sit for 15 minutes before they leave the building. It's just precautionary. We want to make sure everybody's okay before they head out. And she actually complained that she was feeling dizzy and was about to pass out. The funny thing is, it wasn't really from the vaccine. She said she hadn't eaten all day. So we did a point of care glucose test, and her blood sugar was really low. So stuff like that, if we didn't probe further, it would have looked like, oh, she just got the shock and she got the shot and she almost fainted. But that was far from the truth. There was something else that was going on. So it was really nice that we were able to rule out that it wasn't an anaphylactic reaction or a side effect from the COVID vaccine. So I think there's a lot of education that needs to happen out there. There are a lot of viral videos. We need to trust, we need to be getting our information from reputable sources and not just latch onto anything we find on social media. I'm not completely disregarding the nurse fainting, but we do anticipate that a certain number of people in the general population may have more serious side effects to the vaccine. And that's data we really want to have our hands on and be able to allay the fears of majority of people. And like I said, I got my vaccine. I did pretty okay. I was actually a little hesitant also in the beginning, but once I got it, I felt fine. Next morning, I was up and ready to go. So if we can do that education, give that education to the population, that will be helpful. Again, that's the only way, or the only way we know now that we can get back to some semblance of normalcy.
Yeah, so if you have the chance to take the vaccine, do take it. It's the only way for us to get back to some sense of normalcy. Thank you very much, Angela. I'd like to go to some comments from our viewers. So Margaret Opokwa says, "Hello, Angel," and that's, I think, for Angela. She says, "That's my girl, proud of you." Andrew Gladys says, "That's my daughter, I'm proud of you." Rebecca O says, "Hi, Angela." Margaret Opokwa says, "Mommy, I will see your daughter." Oh, Angela brought on a lot of people today. I'm proud of Angela. Okay. We've already answered Wisdom's question, which was on the tests. We have Jessica Shanky J. Jamfi Osil says, here in the UK, we're initially getting this kind of info that COVID was not really affecting children. Dr. Efo also has talked about this particular issue, and I think she's really, she really talked in depth about it. We have Christopher Pong, who's given us thumbs up. Patrick Finn says, very insightful conversation. Great job by the panel. Jay Ajima says, great info. We have Samuel and Cancer Fripong who says, great job, guys. And yeah, we'll get back to some of the comments later on. Now, I want us to switch gears and talk about another pressing issue that is affecting Ghanaians in general. And this is quite concerning because people still have to work. You know, it's not everybody who has the luxury of working from home. So I'd want us to talk about safety in the workplace and how we can make sure that everybody goes to work, has that peace of mind to work. I mean, it's quite difficult to totally get that, pure peace of mind, but somewhat how we can assure people, or we can give people the tips to be able to, practice some safety whilst they are at work. So I'll begin with Kwame. Can you help us or take some of our viewers through ways through which they can have some safety whilst they work? Just a few tips for
Well, the most important thing is about wearing your mask. That's the most important thing. And also making sure that the workplace is well ventilated and it's not crowded. You also have to bear in mind that you have to consistently wash your hands, or if you don't have washing facilities available, which I would find strange in this time and age, but make sure that you have your hand sanitizer to clean up as much as possible. The other thing is, ideally, most workplaces, I would expect that you'd have a thermometer gun so that when you're going in and out of the premises, you can take your temperature. And if you have a high temperature, know that it's not advisable to come to work and rather get yourself tested. Also in the workplace, people need to know their symptoms, and if they get any of the symptoms, they need to test. More importantly, if you test and you're positive, be proactive and inform your colleagues. Don't hide it from everyone or think that, oh, I'm going to be cash strapped, so I'm going to come to work, because you're going to end up infecting so many people and you're going to make the situation worse. So basically, if we want to stop the workplace transmission, the biggest challenge is us and our ability to comply and the ability to be candid. I cannot stop using this word candor enough. This whole issue is about being candid under any circumstances and making sure that you are upfront with your colleagues and with yourself about what you find is happening. More importantly, the final thing is, if you test and you're positive, seek healthcare. Don't try and self-medicate, especially if you have symptoms. If you don't have symptoms, that's fine. Isolate. But if you have symptoms, seek care early. Because the thing about viruses is, if you make your viral load go up and viremia sets in, and your body starts targeting your end organs, then you're going to be very, very, very much ill. And if that happens, then unfortunately, sometimes you might not make it. So those are the things we need to look at our workplace as a place where we protect ourselves.
Yeah. Thank you very much, Kwame. Let me bring in Efua also to add her voice to what you just talked about.
I think he's captured a lot of it. What I found in work with on company health advisory work is that everyone thinks they are not the one with COVID. I don't know what it is, but everyone thinks they are not that person. Oh, it's okay, I have malaria, my husband had malaria. Nobody has malaria nowadays. Even if you have malaria, just stay home. Don't come and expose other people. The chances are you may be fine, but you don't want to be the person who gave someone COVID and the person died. I don't know what your conscience is going to tell you. So follow the rules, your masks, your social distancing, washing your hands, using sanitizer if hand washing facilities are not available. Fresh air as much as possible. This is not the time for air conditioning if you're in a shared space. As much as possible, I mean, what I advise for companies is, if you don't need to be physically present, don't go in. Try as much as possible to work remotely from wherever it is, if you don't have to physically go and sign something or be present to do something. So that's basically it.
Okay, all right. Thank you very much, Efua, and thank you for sharing your time with us today. Elsie, let me bring you in now. So we are talking about the workplace, right? So what in the law protects employees, especially those who have to go to work, those who are being forced to work, even if they are not comfortable, even if they are immunocompromised or they are feeling unwell?
Well, there's the Labor Act that talks about responsibilities that an employer has to his employees. Also, the executive instrument that I mentioned earlier on in the show is also quite clear. I mean, it doesn't give any exception. It doesn't give anything. In Section 3 of the executive instrument actually talks about preventative measures and the fact that people need to isolate if they feel unwell. And so I think that perhaps what needs to happen in the future is some education on what our laws say, and maybe government needs to look at properly enforcing some of these things, because in the words of Winston Churchill, healthy citizens are the greatest assets any country can have. So if we really want to move forward, if we really want to manage this disease properly, such that we have a healthy population, then we need to step up our game seriously. Because if the hospitals are inundated, there's a lot of fear amongst the public, or rather a nonchalance about the disease within the public, then we need to do more. We need to do more.
All right, we need to do more. So thank you very much, Elsie. Let me go through some of the comments that we've had coming in. We have Eunice Cromer, who says, extremely intelligent panel, very good information. We also have Ahmed Mensa, who's asking the question, is it advisable to test a group of people and leave others? We'll have Nana Kofi or Kwame take this one. Baleng Mama Wuto says, in the current state of affairs, what things practically can we do to fine-tune our approach to this pandemic within our unique local context? Nanama Ening says, Ghanaians are not taking COVID-19 seriously. Elsie says, it's tough. And Elo Mochi has a very interesting point. He says, the politicians got us here. They took the pandemic very lightly. Our race communication was not also honest at all. And Nana Kofi Kwame have made this point several times. Nana Mining is again warning us to take COVID-19 serious because it's real. And Mami Ifwa Opoku agrees with what Ifwa just said about organizations needing to let their staff work from home, digitize and cancel out manual paperwork because she believes this will help. And we also have Sewa Trinibua Kodia, who's also expressing her concern with this issue. We have Jessica again, who's happy with the commercial that was broadcast because she thinks it will reach the youth. Elom Ochi also has a comment, and this is in reference to what Nana Kofi said about vaccines being available in Ghana. He says May 2022, with the assumption that God will tarry in his second coming. It's sometimes we have to take some of these things lightly to joke about it to make it, not seem too serious. Vido Kumsen also sent a comment. We also have Mami Opoku, proud of you, LC. Well done. And proud of you, F1 LC. Also, we have Nora Jackson said, and yes, it's good to see you, Angie. Proud of you. So we have a lot of comments coming in today. Very informative, great subtopics, and a number of questions that the public have been asking amongst themselves that you have answered. Thank you. Peter Mensah says testing should be free in Ghana. Yes, we're all out for testing to be free in Ghana. And Jean Birikran says, really informative. Thanks, guys. Proud of you guys. I hope policymakers are watching. We'll do our part and advocate for staying safe. All right. Thank you. So now we're wrapping up. We're going to invite final comments for everybody. I want to bring in Nana Kofi. There was a comment you put on social media this week, and you were commending Ashesi University for their approach. This was also in line with this whole workplace thing. They had reported a number of positive cases they have tested, and then they had also made it as a percentage of those who had been tested. It wasn't just throwing out numbers where we had a GSA, only 3 people have been tested positive. 3 out of what? 3 out of 4, 5, 6, who knows, right? So the question I have is, do you see any institutions taking the Ashesi approach towards COVID-19? And if others are not, what are the limitations and how can we improve this?
Well, I do think there are a few private institutions that are taking up Ashesi's approach. I think those are institutions that, by virtue of their nature, have a duty of reporting to parents or to guardians, to other stakeholders, and some of them are taking that quite seriously. But it's quite clear that the majority of workplaces don't have those kind of provisions, and they're struggling to really figure out how to navigate this. I'd hope that shortly, Ghana Health Service or the Ministry of Labor and Employment can put out a guideline for employers to know how to manage workplace outbreaks and what reporting expectations that they have to the Ghana Health Service and other responsible agencies. What we want to see going forward is more, of that critical stuff being taken care of. We've already had a lot on the panel, and I think it's all fantastic stuff about what we can do in the workplaces. The only thing I would add is that if you do work in a workplace where you have to go in, it's not ventilated well, and distancing isn't possible because of the layout or because of staffing numbers, then you might want to consider wearing a more protective mask than just something that's source control like a fabric mask. That's why during the week, really over the last few weeks, there's been a lot of recommendations in the United States for use of KN95 masks and N95 respirators. I think in Ghana, we should not encourage N95 respirators so those can go to the healthcare system. But I think for the KN95 mask, if you work in an environment that is high risk, it's air conditioned, you can't open windows, everybody's required to come to work, it's not distanced enough, it makes sense to get something that's more protective, that actually filters out some of the virus so you can reduce your risk in these settings. But that's the last thing I'll add to the question of the workplace.
Okay. All right. Thank you very much, Nana Kofi. There's a question that came in on vaccines, and I want to bring in Angela to address this this one. So it's from Angela, and she says, "My understanding is that the vaccine will not prevent us from getting COVID-19, but will prevent us from getting critically ill. How true is this, Angela?"
Yes, Nara, that statement is absolutely true. So, what I tell my patients every day is, let's say the person is there to get a flu vaccine. When you get a flu vaccine, it's not absolute that you're not going to get influenza. The intent here is, even when you get influenza, your severity of the disease is much reduced versus someone who is not immunized against influenza. So if taking COVID-19, for instance, if you're vaccinated and you end up contracting the coronavirus, the rationale here or the belief here is that you may not have severe disease needing hospitalization or an ICU bed. So again, if we can and are able to take the vaccine when it becomes available, I would encourage everybody to take that step. Vaccines are good. If we can eradicate a disease completely with a vaccine, that's great. But most vaccines, the intent for most vaccines is to reduce the severity of the disease they're preventing.
Okay. All right. Thank you very much, Angela. So let me bring in Kwame Sapumasidu to give us his last words before he goes. There's one question for Angela, and I'll bring you on to answer it. It appears we will have to have another session on vaccines where we'll delve into this in more detail. So, Kwame Sapumasidu, if you can add your last words to this discussion.
Yes, I mean, there was a question about testing where someone was asking whether it is sensible to test some people and leave the others. A simple answer to that question is, if all the people are exposed, then it's naive to test some and leave the others. The only reason why you wouldn't test somebody is if there's no evidence of exposure. So if there's exposure, then you have to test everybody.
Mm-hmm.
And my final comment would be that at this point in time, we are in the phase of self-preservation. It is you who owes yourself a responsibility of keeping yourself safe. In doing so, you need to ensure that you use positive peer pressure as well, because if you let people within your vicinity get infected, they'll end up infecting you, even with the best will in the world. So whether you're at your workplace, whether you're sitting in a truck, whether you're doing this, don't be too scared that, oh, they are not doing what is right, but if I say they'll gang up against me, because if you don't allow them to gang up verbally against you, they'll gang up as microorganisms against you, and that would be worse than them actually insulting you, because you might end up in an ICU. Thank you.
So there you have it. You might end up in an ICU if you lose or let your guards down. We'll bring in Elsie to give her final words, and then we'll leave.
So interestingly, I've just seen an article on City's website from the GMA saying that if the president doesn't ban gatherings, they're going to encourage the members to put their tools down, because the health system is on its knees. So I'd like to say clearly at the moment, we really have to think for ourselves. The legal provisions are not particularly being enforced, although that would be nice, even though we have an IPC policy that says that healthcare workers should have consistent training. None of that is being done in all facilities. I think maybe it's been done scantily in some, but not all, because obviously there's a lot of pressure. So I'd echo everyone's words to say, stay safe, and yeah, just keep your distance. It's not enough to put on a mask and think that you're safe. Keep your distance as well. Thank you.
All right, thank you very much, Elsie. So the last thing we'll do is to take Angela's answer to a question that came in on vaccines. And the question is, Angela, can you transmit if you've been vaccinated? And this is
That's
from Jean Brekran.
That's a great question. I believe it's Jean. So
Yes.
unfortunately, right now, we don't have data to support whether someone who is being vaccinated or who is asymptomatic, has asymptomatic disease, got the shot, can actually transmit it. So I don't know if you missed the first part of my presentation. I actually did mention that. So as and when we can get more people vaccinated and we can get more robust data in that regards, we will be able to um, pointedly say that once you get the vaccine and you're even asymptomatic, it prevents the spread of the disease. So more information to come on that. I think the jury is still out. So as and when data becomes available, I'll be happy to share with you all.
Okay. All right. Thank you very much, Angela. I think this is all time would allow us. We've exhausted our 2 hours, and it's been a really wonderful discussion. We have so many comments coming in. We really do need to have a session dedicated to vaccines. So we'll talk about the vaccine supply and then also talk about how vaccines work and get more into detail with personal experiences from Angela on these vaccines. So it's been a wonderful discussion. Is Edward still with us? So I'd want the last comments from Edward before we leave.
All right. So yeah, before we actually wrap up, I don't know if Ifwa is still here. I'd like to bring her on for her last words, and then I'll wrap up.
So for me, I think this pandemic presents a window of opportunity to take a critical look at our health system and start solving problems. I mean, what it's done, it's exposed the problems that we've had for a very long time. It's just on a bigger scale now because of the pandemic. So we need to start looking at different things, including, aside from just building the hospitals and building facilities, the training of the people to staff the facilities, are specialist training. This takes too long, too many years between house job, getting into a specialty, and there's no laid down procedure. We need to look at medical supplies. There's so many aspects of this of our health system that this pandemic has shown is weak. The laws that protect health workers, the laws that protect patients. So we need to sit down and take this as a chance to look at where the problems are and what we can do to solve them. So that's basically what I can say in closing. Thank you.
All right. Thank you very much. And again, thank everyone that tuned in to listen to us. I have a little announcement that those who are in Illinois, Chicago area, there is actually a free COVID-19 testing going on in Bolingbrook, Illinois. And you can go there between 11 o'clock a.m. to 3 o'clock p.m. And you'll be able to get a free testing as well. So again, Kwame, this was a fruitful conversation. We had great minds as usual. Please like our feed and share it. If you have any questions, keep them coming and we can even answer them after the show. So that's all I have to say, Kwame. You can take it away.
All right. Thank you very much. I would like to express our gratitude to all our panelists for being on here to share information with us. You'll be seeing some of them regularly with us. I'd like to add that Dr. Angela Mensah is joining the Health Info Africa team as a host. So you'll be seeing her regularly on this show. So welcome, Angela. It's nice to have you on board, and we look forward to having you share your experiences. Next week, we have Lamese here with us again. And it's going to be another wonderful discussion. So stay tuned. Join us next week for this discussion. So yeah, that's it for now.
surpassed China related to this virus and the outbreak.
It no be one photo, say we dey fight corona. But as we dey take precautions, I get the feeling, say we go overcome 'em.
It no be one photo, say we dey fight corona. As we dey fight, we for pay attention, yeah.
Before you sanitizer, for one suffer semen.